Sir, I'll be washing my hands for making sure we're nice and clean to examine our patients, disinfectants. My name is Kumaran. Your name, sir?
Marcel,
And how old are you, sir?
54.
Thank you very much, sir. Can I have permission to treat you?
Yeah, no problem.
Thank you, sir. So we're going to be examining your knee today, looking for any abnormalities of your knee. And the first thing I want to do is ask you history. From the time you were a little boy till now, have you broken any bones?
No.
Any dislocations?
No.
Any surgery?
No.
Do you take medication for anything?
No.
Take vitamins for anything?
No.
And have you had any major particular injuries that you think that's not so important of your knee particularly?
No.
Thank you, sir. So the next thing I want you to do is to walk, and we're going to be examining your gait. And we're examining your gait, we're looking for biomechanical abnormalities. Are you walking with a limp? Are you walking one hip high, one hip low? We're looking for shoulder symmetry, scapular symmetry, hips and pelvic symmetry, coxavaris, coxavalgus, genuvaris, genuvalgus, and any flat feet, pronation, supination. So I want you to walk for me, sir, and we're going to assess your movement. So we're going to do a biomechanical assessment of the gait, asymmetry of shoulders, scapula, etc. The entire body. Thank you, sir. Come have a seat. So the first thing that I want to do is active range of motion of your knee, and you just imitate what I do, sir. Okay, so I want you to actively extend your knee and actively flex your knee. Actively extend your knee and actively flex your knee. Any pain, sir? Thank you, sir. We normally do it both sides, but just for examination purposes, we can do it all on the right. Now I'm going to do passive range of motion of your knee, sir. So we want to extend it and flex it, and we're feeling for crepitus, we're feeling for any abnormal movements, any abnormalities of the movements and right and left. Okay, next I want you to lie on your back. Right. So normally we have our patients fully exposed from the hips all the way to the foot area, examining everything right and left. We're looking for any scars, bumps, bruises, signs of infections, Baker's cyst, abnormalities of the patella. We're looking for any signs of abnormalities of skin, muscles, ligaments, tissues, and bones. Then we want to palpate the knee itself. Palpate the medial aspect, the lateral aspect, the anterior aspect, the posterior aspect, and we're feeling for good architecture. We're looking for abnormalities, but if everything is good and anything abnormal, we make a note of it right and left. Okay, sir. So I want you to know that the next test we're going to do is the dermatomal examination. And normally dermatomes are checking for hot and cold, sharp and blunt. So dermatomes is on L1, L2, L3, L4, L5, S1, S2 at the back, S1, S2 at the back, into the glutes, S1, S2, and in the coccyx and anus, S3, S4. Then we want to check your reflexes, which is your knee reflex and your ankle reflex. So you can have a seat for me, sir. Right. So we want to check the ankle, the knee reflex, which is L3, and we want to check the ankle reflex, which is S1. So Achilles tendon and patella tendon. Abnormalities comparing right and left. That is dermatomes done, reflex is done, and now we move to myotomes. So for myotome, we want to check hip flexion. So pick your leg up for me, sir, thank you, and hold it. That's hip flexion, and move it down. Hip extension. Then we want to check hip internal rotation, hip external rotation, all in resisted. And then we want to check hip, you keep it together, sir. Hip abduction, move it out. And move it in, hip adduction. Then we want to check knee flexion, move it back, sir. Move it forward, sir. Knee flexion and knee extension. Then we want to check big toe extension. So pick your toe up for me, sir. And I resist it, thank you. Ankle inversion, all in resisted. Ankle eversion, all in resisted. We want to check for dorsiflexion and plantarflexion. Push it down, sir, and push it up. Dorsiflexion and plantarflexion. Always checking right and left. Always looking for abnormalities. right and left. So next we want to check your knee particularly, sir. I want you to lie on your back for me, sir. And you want to check for, firstly, the medial collateral ligament, which is the valgus stress test. Lateral collateral ligament, which is the varus stress test. Anterior draw test for anterior cruciate ligament. Posterior draw test, posterior cruciate ligament. And then we want to check for Lachman's test, which is for anterior collateral ligament. And then we want to check on the joint line, which is McMonnish test for the medial meniscus. And we want to check for lateral meniscus. Thank you, sir. And looking for popping and clicking. Then you want to sit up for me, sir. Lie face down. And then we're checking the meniscus for Apley-Grimes test and Apley distraction test. All looking for signs of pain and abnormalities. You can come and have a seat for me, sir. Right. So looking at the assessment of your dermatomes, myotomes, reflexes, assessment of your knee, your hips, everything seems to be okay. So you have permission to go to the gym, make an appointment with a personal trainer, and you can start some leg conditioning. Thank you so much for your time and have a good day.
Thank you.
Thank you. Bye.